This is KGW News at noon.
Well, once sunrise hit, the parking lot at Timberline Lodge started to fill up. This time lapse shows all the skiers and snowboarders arriving at Mount Hood this morning. Ski season is officially underway. Good afternoon, everyone. I'm Brenda Braxton. Ski resorts were not included in Governor Brown's 2-week COVID freeze. But before you just head up to the mountain, be prepared for some changes. You'll need to wear a mask, and there are social distancing rules. Timberline was going to use a reservation system, but now the resort says it's ditching that idea starting this Saturday. It'll be first come, first serve based on how many cars can fit in the lot. You're advised to arrive before 9 a.m. to grab a spot, or try the afternoon when morning skiers start to head home. Mount Hood Meadows is set to open on Monday. It'll make a limited amount of date-specific lift tickets available online, but pass holders will not need a reservation. We want to bring in meteorologist Rod Hill now. And Rod, good conditions on Mount Hood for opening day.
Yeah, perfect. I mean, a good base. We've got some nice fresh powder. It's still coming down. This is one of our 2 live Timberline cameras. You can see the day parking lot there, and we've certainly had lots of activity of folks up there with their boards and skis. As I mentioned, the overall snow conditions are terrific, especially for opening day. Timberline says they have 44 on the ground. They picked up 7 inches going back to last night, and they could see a few more inches fall through early evening. Meadows not quite open yet, but they do have 43 on the ground. Ski Bowl still trying to build. They have 10. They picked up 4. And Bachelor has 36. They picked up 5 inches. If you are traveling up over the Cascades today, here's the highway at Government Camp. Clearly, it's slow going with a lot of snow on that highway. 31 degrees, holding just below freezing. Government Camp maybe just about freezing today. Again, the 24-hour total up there around Mount Hood, 5 to at Timberline as much as 10 inches. And that snow level seems to be holding at 3,000 feet. Quick look at the radar, still showing showers coming. Pretty quiet right now between Portland and Salem. And we'll talk about the valley weather moving into your holiday weekend coming up shortly.
Okay, sounds good. Thank you, Rod. Well, this is usually one of the busiest travel days of the year. But like everything else in 2020, it's anything but normal. Governors in Oregon and Washington are pleading with people to stay home and keep Thanksgiving small. But with many not listening to the warnings, Drew Carney has some safety tips from the CDC.
Let's start with driving. If you're driving to your destination, wear your mask at the gas station and pack your meals ahead of time. That way you don't have to stop at any restaurants. Overnight guests should put their bags away from common areas as soon as they arrive and wash their hands immediately. If it's going to be an extended stay, wash masks and clothes separately from the rest of the household. This includes college students who are coming home from campus. People from different households should wear masks inside and out, basically anytime they aren't eating or drinking. And make sure to screen yourself and guests for COVID symptoms. It's also not a bad idea to have a designated room for quarantining in case someone does start to feel sick.
And if you have been exposed to COVID-19, you may not have to quarantine quite as long. The CDC is considering updating its guidelines. Right now, it recommends isolating for 14 days, but the CDC may drop that to 7 days. The update will likely incorporate testing. We still don't know the exact wording of the new guidelines or when they'll be announced. Federal and state governments are preparing to distribute a COVID vaccine as early as mid-December. The first doses will be for frontline workers and for vulnerable populations. 3 pharmaceutical companies are waiting for FDA emergency authorization. One of them is Pfizer. And here is the ultra-cold coolers that will store Pfizer's vaccine. The company says it's 90% effective, but the vaccine needs to be stored at almost 100 degrees below zero. That freezer, by the way, costs about $10,000. Hospitals in Oregon and Washington are concerned about the surge in COVID cases. They want to make sure they have the resources to handle an influx of patients. Glenn Farley explains how Washington officials are making sure the state has enough hospital beds.
What happened to hospitals during the spring COVID wave may be just a preview of what we can expect to hit the Northwest come January, February, and March. Will there be enough ICU beds? Will there be enough doctors, nurses, and other staff to take care of us? And this is one thing making hospital administrators nervous. The latest projections from the UW's Institute on Health Metrics and Evaluation finding that at its peak in late February, the state could need 667 ICU beds. There are only 341 available statewide where things stand now.
And that's our big concern, because as you look at the IHME projections, then you begin to really see a constrained system where incredibly hard choices may have to be made.
Dr. Steve Mitchell heads an organization which is playing a critical role in managing COVID's impact on the state's hospitals. It's called the Washington Medical Coordination Center, and it's located at Harborview. Already, the state's hospitals are trying to make room by rescheduling elective surgeries like knee replacements and the reestablishment of field hospitals like we saw in the spring.
And so it's all part of a kind of a stair-stepped progression as the disease burden increases.
And then there's this. Harborview is the only level 1 trauma center in the region, serving patients from the Northwest and Alaska. But what happens when those states are being overwhelmed with their own COVID patients?
When those options aren't available to people locally, we are asking states to take care of COVID patients within their state. Once they have exhausted their state resources or ability to place that patient, then we would get involved.
We cannot have people dying in the parking lots of our hospitals.
Governor Jay Inslee again urging people not to gather to keep hospitals from running out of rooms and staff.
Unless something changes, we very well could be in a situation with catastrophic loss of medical care in the state of Washington.
That was Glenn Farley reporting. We also caught up with a nurse at OHSU who's been working in the COVID ICU.
So stay home, please. And I know it's hard. We're all so tired. I hope that they understand that these little actions and decisions and choices that they make in these coming days and weeks about whether to get the family together or whether to expand their bubble just a little bit for these celebrations that we love, that the impact could be devastating. It could be their loved one in my ICU bed.
That's Erin Bonai, and she fears if the Oregon surge continues, it could affect the entire healthcare system.